Micah Calvert, Fort Wayne. Micah has moyamoya disease, which causes blockage of the blood vessels at the base of her brain. She has undergone 2 brain surgeries at Riley Hospital for Children. Micah is now a student at Horizon Christian Academy.
Ozzie Raher, Evansville. Ozzie was born with a congenital heart defect called transposition of the great vessels. At only 48 hours old, he needed life-saving open-heart surgery at Riley Hospital for Children. Ozzie had a stormy post-operative period with plenty of complications, but is doing great today. He is very active and enjoys learning about animals and insects. Ozzie also loves to talk and introduce himself and has 2 younger siblings.
Josh Clark, Fort Wayne. Josh was born with a rare set of heart defects called Schoen's complex. He had his first heart surgery at only 2 days old, and then another open heart surgery at 8 weeks old. He will need more open heart surgeries as he grows, but Josh knows that since Riley fixed his heart once, they will be able to do it again. Josh enjoys playing basketball, drawing, and running on the cross-country team.
J.C. Thomas, Indianapolis. J.C. was diagnosed with myasthenia gravis, a rare disease that disrupts and attacks the signals to the brain that controls voluntary muscle movement. She has undergone several procedures, including the removal of her thymus. J.C.'s family is hopeful that this surgery will have positive long-term results. She enjoys singing with the choir, acting in theater productions, and is in a club that makes blankets for shelters.
Rosemary Antonelli, Granger. Rosemary was diagnosed with multiple congenital anomalies and probable charge syndrome. Rosemary is an extremely joyful child. She loves being around people and has a hug for everyone. Rosemary loves music and often breaks out in dance when she hears a good beat.
Autumn Pearson, Crawfordsville. Autumn is a student at North Montgomery High School and was born with spina bifida. Her hobbies include swimming, scuba diving, and hanging out with her friends. Autumn dreams of becoming a special needs teacher as well as a chef. She also loves spending time with her mom and dad.
Kaylee Phillips, Cedar Lake. Kaylee was diagnosed with a tethered spinal cord, spina bifida occulta, and neurogenic bladder. Just 2 weeks after undergoing spinal cord surgery at Riley Hospital, she began preparing for her first 5K with the program Girls on the Run. Kaylee's many hobbies include arts and crafts, running, and learning about horses.
Max Heffernan, Indianapolis. After developing kidney problems, Max was admitted into newborn intensive care unit at Riley Hospital. He was born with posterior urethral valves, a condition that was fixable with a quick surgery, but Max had significant damage in his lungs, bladder, and kidneys. He receives daily dialysis treatment. Max's family is grateful for the compassionate care they receive at Riley.
Lydia Daly, Bluffton. Lydia and her family were in a car accident in December 2010 while in Minnesota. Lydia was flown to Riley for rehabilitation once her condition was stabilized. She was in the pediatric intensive care unit until January and needed another surgery to have bone fragments placed back into her skull. Lydia is now a student at Bluffton Harrison Elementary School and enjoys singing and dancing. She continues with outpatient therapy and is making great strides.
Marley Davenport, Bloomington. Marley has been a Riley kid since the day she was born. She spent the first 6 months of her life there due to chronic respiratory failure and thoracic insufficiency syndrome, which requires the use of a ventilator at night. Even after undergoing 18 surgeries by the time she was 8 years old, Marley has always been a happy, positive, and loving little girl. Marley is a student at St. Charles School and enjoys attending Riley dance marathons to help spread awareness about Riley Hospital.
Cannon Hoops, Indianapolis. Cannon had a birth injury in 2004 that led to a diagnosis of spastic quadriplegia cerebral palsy. He has a passion for creating art and even was commissioned by the ARC of Indiana. Cannon attends school at IPS Center for Inquiry 27, which he loves, along with reading, watching cartoons, and playing with his iPad. He also likes traveling and has already been to Italy, Turkey, Greece, Japan, and several Caribbean islands, all by the age of 10.
Annie Phelps, Indianapolis. At just 27 weeks gestation, Annie was diagnosed with pericardial tumor. I know, you don't even have to start over. I thought so.
No, remember it didn't record.
Annie Phelps, Indianapolis. At just 20... Did you...
No, it's still going.
Oh my goodness.
It's still going.
Annie Phelps, Indianapolis. At just 27 weeks gestation, Annie was diagnosed with a pericardial tumor, which was wrapped around her heart. Within 18 hours after her birth, Riley heart surgeon Dr. John Brown removed the tumor successfully. Annie is now an active student at St. Simon's School. She loves all sports and is very competitive. Annie also likes art, singing, and playing with dolls. She is a wonderful sister to her 4 siblings.
George Guy IV, Fort Wayne. George William Guy IV was born with sickle cell anemia and receives treatment at Riley Hospital for Children. George attends Deer Ridge Elementary, where he excels in reading and math. He has a brown belt in Taekwondo and plays the piano. He enjoys reading, playing video games, basketball, football, and baseball. George's hobby is collecting comic books and drawing the characters. He also loves spending time with his 5 siblings.